Hi, my name is Vanessa Lancaster, and I'm currently a nursing student working at Heartland Nursing Home. I'm going to present a patient today. Patient is a retired Caucasian, 77-year-old female. She is divorced and her ex-husband has since passed. She lives with her son now and grandson. Her former occupation was building water pumps in a factory. Patient was admitted to Heartland Health Center on February 2, 2014, in order to obtain treatment for her chief complaint being a UTI and her dementia. Patient states that she is able to perform daily activities and gets exercise by cleaning around the house. Patient's vital signs were recorded with a blood pressure of 140/95, respiratory rate of 19, and pulse of 72. Patient's past medical history includes type 2 diabetes, neuropathy in foot, dementia, COPD, stage 3 chronic kidney disease, and a stroke 2 years ago, and emesis. Her immunizations are all up to date and has no allergies. Patient's past surgical history includes a hysterectomy, an endarterectomy of vessels of head and neck in 2010. Patient's current medications for COPD are albuterol, Symbicort, hydralazine, and Florent. Patient's current medications for diabetes are gabapentin, glipizide, Lantus, and Humalog. Patient is also currently taking aspirin as a blood thinner, Aricept for dementia, Nexlum for acid reflux, metoprolol to lower blood pressure and heart rate, Zoloft for an antidepressant, Bactrim as an antibiotic for her UTI, and Zofran for anti-nausea. Functional assessment of patient is that she was a past smoker, but denies any alcohol or drug use. For exercise, she is in physical therapy and cleaning around the house. Patient states that she does not sleep much and never has been much of a sleeper. Patient also states that she does not have a very balanced diet with a lack of fruit and vegetables. Patient states that she does not drink coffee, but drinks Diet Coke daily and cold tea. Psychosocial data of patient is that she lives with her son and has 2 grandsons. She is a cat that she loves very much and enjoys the company of her family. She also has lots of friends through her church group and enjoys traveling with them. She likes to go to the casino with friends as well. She is a Catholic and attends church when she has a ride. She says that she stresses out daily. Her environmental hazards include having worked in a factory for over 30 years. Her education level is high school graduate. Her primary health care provider is St. Joe Hospital in Ypsilanti. Family history of patient is that she has a sister in Florida that is 80 and has heart problems and is currently on oxygen. Her mother lived till she was 98 and passed away due to old age, and her father also lived into his 90s, passing it with old age as well. We performed a respiratory assessment on patient due to her long-standing COPD. We found that patient had a barreled chest accompanied by shallow breathing. Her trachea was midline and her expansion was normal, but was taking faster breaths. Every other findings were normal, with no consolidation in the lungs. We also performed a cardiac assessment on patient due to her type 2 diabetes or hypertension. Everything appeared to be normal with patient, with no heaves or lifts over chest. Also, patient had no thrills or lifts. We were able to auscultate at S4 due to her long-standing hypertension. Pertinent system number 1 for patient would be a genitourinary reproductive assessment due to her UTI. Especially since patient has dementia, it is sometimes hard to catch the symptoms of a UTI. According to the journal I read in Alzheimer's Society, you need to pay attention to change in behavior and increase confusion and withdrawal. The journal also talks about identifying the infection as soon as possible because any infection can speed up the process of dementia. Pertinent system 2 for patient would be a nutritional assessment because patient has not been eating very much since admitted, and it is important for her health to have a good balanced diet. According to the American Journal of Clinical Nutrition, it is important for their immune systems to have good nutrition. Also, according to the American Journal of Clinical Nutrition, because aging and malnutrition exerts cumulative influences on immune responses, many elderly people have poor cell-mediated immune responses and are therefore at a high risk for infection. Since infections can speed up the process of patients' pre-existing dementia as well as affect her type 2 diabetes, it is important to review this system. Thank you.